Well, from the Community Civic Association, today we have Lisa Colovetti, and I'd like to welcome you, and your guests, Dr. Norman Vinn. And Doctor, we'll get to you in just a moment, but first we're going to talk about the meeting that is coming up. That is tomorrow. That's Thursday, the 26th at Clubhouse 5.
Exactly, yes. So the CCA, we're having our July event tomorrow, and it is about house calls. And we're going to have a wellness center there. Memorial Care Home Health will be there to help out with medication reviews and blood pressure checks. But we're very excited to present Dr. Vinn and our discussion about house calls.
Welcome, sir. Nice to have you here today. So, I asked about this before we got on, and my first question to you was, and you can answer this right now, does somebody have to pick you or this your medical group as their primary care physician to have a doctor come out to their home?
I think the answer is, as with many things, it depends.
Yeah.
If they're on traditional Medicare fee-for-service and they can't get out to see the doctor, we are, in effect, their primary care physician.
All right.
They choose us to take care of them. They do not have to sign up for us on a list.
Okay.
If they're managed care, they may need a primary care office doctor or the managed care group to request our services, and then we go there to assist the office-based primary care doctor and be their eyes and ears and hands and heart, I hope, to help take care of the patient.
Yeah, because I'm looking at your title here. You're the founder and chief medical officer of House Call Doctors and Medical Group. So is that primarily what the doctors that are within this group do, that you focus on getting out to people who cannot make it into the actual office for some reason?
We actually do nothing but house calls. We made a commitment to this nearly 20 years ago. And I think the first question is why? Why would we do this? And there are a number of people out there that are either frail, they have mobility issues, some are bedbound, and they're really not getting good access to care. They can't get out of their homes, some of them with great difficulty and some of them not at all. And they deserve access to care. They deserve continuity. They deserve somebody who's going to look at the whole person and try to not only do treatment for active illness, but also work on their quality of life, on symptom management, on advocating for the other issues, what we call the social determinants of health, that have a great impact on their care.
Right, yeah, that's very true. And one of the things that I know you, Lisa, with CCA, you focus on is finding folks the right services that are going to fit their needs, whatever it may be.
That's right, exactly. And on that note, for example, we have a brain health specialist, Allison, who will also be there talking about cognitive care. So she offers classes, and she'll be talking about people that can watch on TV, can see her from TV, but they can understand about cognitive care and brain health.
Yeah, that's obviously an important thing as well. And as far as you go, doctor, you are not a home care provider. You are a doctor. We want to make that clear. You're a regular physician, but providing the service of something that was done decades ago.
Exactly. Sometimes something very old becomes something very new.
Yeah.
And our industry, while the basics have not changed, looking at the whole person, compassion, humanism, we have some other technology resources, and we become what I call virtual team leaders. We help aggregate and orchestrate resources to make sure people get what they need. It may be Lisa's company, which is Memorial Care Home Health, but it could be physical therapy, it could be a wheelchair, it could be home intravenous and antibiotics, it could be a podiatrist. There's home dentists that will go out.
Yeah, there
are.
Yes.
We're trying to be this hub to try to help make sure the right team is taking care of this patient. Could be Meals on Wheels.
Yeah, and you mentioned something about technology. nowadays, a lot of that technology can be all fit into a small little bag. Maybe not the little black bag that you probably had years ago, but nonetheless, you can bring that into somebody's home, very quickly set up what you need,
Yes.
do whatever needs to be done, and in a half hour, you're done.
Yeah, there's two pieces
Yeah.
of it. One of them is the on-site diagnostic technologies. There are some technologies that are better and more effective than others, but we have technologies that we can evaluate lung function. We can evaluate the function of the nerves and the blood vessels in the legs. But we also have phlebotomy services, so if a patient needs a blood test, we can get their blood drawn, sent out to the lab so they don't have to go to the lab.
Yeah.
There's home x-ray services, and we will call them, they'll come in and do an x-ray, and if a patient has pneumonia or congestive heart failure, hopefully we can treat it in the home without forcing them to go to the emergency room and be admitted to the hospital.
Now, as far as these patients go, is it like any other patient that a doctor would have, that they would call you up saying, instead of me coming to the office, I'd like you to come out today for this reason? Or do you have certain patients that maybe you go out and see on a regular basis?
Well, we have both. Actually, we do try to put patients on somewhat of a care cycle so that we can do as much preemptive care as possible and kind of monitor them. But there's always out of cycle visits where somebody has had an event or is declining and we need to get to their home, get some resources, maybe treat a urinary tract infection, things like that, which can have catastrophic consequences in the elderly if it's not properly treated.
And staying in their home is certainly a lot better.
Yes, I mean the hospital is a great haven of technology. Speaking of technology,
but for the type of things that you're coming out for, it's
Well, there are times the hospital is in the emergency room are absolutely essential.
Right.
But every time you go in the hospital, there's attendant risks, and the hospital people will tell you the same thing. The risks of nosocomial or hospital-acquired infections, the risk of falls, the risk of ICU delirium, and when you have to go to the hospital, we send people to the hospital regularly. But if we can avoid that safely, we will.
Yeah, and great service. Now tomorrow the meeting is going to go from 11:30 to about 3:30, right?
Yes, tomorrow.
So a lot
Free
going
lunch.
on.
Right. Nice free lunch. We have superfoods, so that are brain healthy foods being served for lunch. And we're excited about that.
I've got to tell folks that I know you usually like to have an RSVP, right? Especially when there's lunches. So
thank you.
The number is 949-426-1598. And if you forget that, you can go to lagunawoodsvillage.com and then go to CCA and get information there. But it's at Clubhouse 5
Clubhouse
tomorrow.
5, yes.
Very good.
Thanks so much.
And of course, Dr. Venn, you're going to be there?
Yes, I look forward to it.
All right, great to have you on. Nice to meet you, sir.
Nice to
I
meet
like
you.
the service that you're doing, bringing house calls back. Kind of nice.
We're trying to create access and continuity.
Yeah, I think that's really good. Very good.
Thank you so much,
Doctor,
Ken.
good to see you.
Yeah,
Maybe we
nice
can do it back, get house calls for kids again one day.
Oh,
That would
gosh,
be nice.
that's a good idea.
That's a possibility.
Yeah, it's not a bad idea. All right, we'll be right back.
Thanks, Ken.